And welcome back. Well, today we have on, guess who's been with us before, Dr. Jack Shohet of Shohet Ear Associates. Nice to have you back.
Thank you, Ken.
And today you want to talk about something I never heard of. It's a disorder. It's called Meniere's disease. Did I pronounce that right?
You did, Meniere's.
And it's a disorder of the inner ear that, and as we know, the inner ear certainly obviously affects hearing, but more importantly, it affects balance, doesn't it?
That's correct. It participates in your hearing and in your balance. It plays a big, important role in your balance. Meniere's disease is a disorder that causes episodes of vertigo that last for 20 minutes to several hours. Typically, it's associated with fluctuating hearing loss, ringing or roaring in the ear, and fullness or pressure or plug feeling in the ear.
How do you kind of know that maybe you have an inner ear problem, whatever it may be? We all have ringing in the ear now and then. I don't know what causes it, but everyone gets that, or we get up and a little bit of dizzy for a little bit. So what is that point where you're noticing, okay, maybe there's something more going on here?
That's a really good question. In fact, a lot of physicians, including myself, sometimes struggle to determine whether the cause of someone's problem is coming from the inner ear. There's not a clear-cut symptom that would tell you one from the other, but there are clues that we rely on that might identify a problem that someone's having as being part of an inner ear problem.
Okay. When people do get ringing in the ear, just the standard ringing in the ear, where does that come from? I always wonder that. Now, we're not talking about you were at a loud rock concert and you hear that. All of a sudden you hear a little,
right.
Almost like you're hearing a little tone coming from somewhere. How does that manifest?
Most people would think that it's coming from their ears, right?
Yeah.
You're hearing it with your ears, you think it's coming from your ears, but it turns out that a lot of ringing actually comes from your brain. The way the brain cells talk to one another can sometimes cause the sensation that you're hearing something.
It's like that little low tone.
That's correct. Right.
Interesting.
So it can actually come from the inner ear or the brain.
Wow. Now, Meniere's disease, this is something that obviously takes us to a new level. People can suffer from this on and off. And if someone does suffer from this, is it something that every week they'll get it, maybe every month? It just totally depends. And one of the things that a doctor sent me was information about a very famous TV and Broadway star, Kristen Chenoweth. And if you don't know who she was in many, she's been in many TV shows, but the most famous thing that she's been on over the last 10 years is the play, I can't think of it.
Wicked.
About Wicked. I wanted to say the Wizard, but Wicked, yes. And if you saw her, you know exactly who I'm talking about. But she has suffered for this and actually at times needed help by people working on the production of getting her on and off stage. So this is obviously very severe.
It is very debilitating. For some people, it is life-changing. The symptoms can occur sometimes without warning. They can last for, as I said, 20 minutes to several hours. And so if you're planning on showing up to work and doing a job and you suffer from this problem, you could be debilitated. You would have to stop what you're doing and potentially lie in a quiet room for several hours. Sometimes it's associated with nausea and vomiting. Some people will get tremendously sick during one of these episodes. So it is potentially incapacitating, certainly during the event. And just because it's unpredictable, it's debilitating.
What's going on in the inner ear during this time? Is there fluid buildup or not flowing, or what's going on?
So from a standpoint of the anatomy, within the inner ear there are two different chambers that contain different types of fluid. And these two different fluids, they have to be separated and they have to maintain a separate nature. With Meniere's disease, there is a rupture of the membrane that contains these two substances, these two fluids, and there's an intermixing of these two fluids that somewhat poisons the inner ear during the episode.
Wow.
And that's what is thought to cause the episodes, the symptoms that are associated with Meniere's disease.
Interesting. It's kind of like oil and water. They're not mixing right. You
Right.
don't want them together. So you wanted to talk about that there is a study program going on right now. And tell me about that and what's going on to find out more about this disease.
Well, first of all, Meniere's disease can be somewhat tricky to treat. There are some very good medical treatments, and sometimes diet is the only thing that's necessary
Oh, really?
to
Wow.
treat people, maintaining a strict low sodium diet, watching sodium. But after that doesn't work, there are other medications and other therapeutic maneuvers that we do. One of the newer treatments is a drug therapy, and we're participating in a multi-center clinical trial to investigate the efficacy of this particular medication.
Would this be a medication that if someone is diagnosed with this, they would take continually or only when an episode happens?
It would be given probably more prophylactically.
Okay.
Or when you've identified someone with a problem, you might give it to them to prevent further episodes down the road.
And you're looking for people to be a part of this study, or find out more about if they
to find out
this possibly.
Right. To find out more about the clinical trial, we have a phone number
Okay.
that patients could call.
All right, and that's 562-270-4327. We have that up there. And that is that a Long Beach number?
It's
Just to make
it's
sure.
in Seal Beach. It's
Okay,
our Seal
Seal
Beach
Beach.
Research Department.
Okay,
Yes.
and how long have you been working with this? Is this something not many people probably have heard of this, but how long ago did you first come across this disease and look into it?
So by training, I'm an otolaryngologist
Yeah.
and ENT surgeon, and I did a subspecialty training in otology, neurotology. So it's my field, my background is ear-related disorders. It makes up a big part of what I do because this is such a debilitating problem that
Yeah.
a lot of people seek a specialist such as myself when they have Meniere's or they suspect they have Meniere's disease. So I'll see a lot of patients that refer themselves in or physicians that refer their patients in when they suspect they have an inner ear disorder such as Meniere's disease.
Okay, and right now, we just gave the number out, but people might want to know how long is this going on, this study, this clinical trial?
The clinical trial, I think, is going on through October
Okay.
of this year. Sometimes those deadlines change depending on enrollees, but I believe we're enrolling through October of this year.
Okay, and with many clinical trials, the first step is somebody to be evaluated. You want to see if they're a candidate for this, correct?
You would have to definitely evaluate someone to determine if they meet the criterion that we're looking for to participate in the trial.
Okay. When someone does have this, are episodes something that maybe it's every few months, maybe, it's like people have migraine headaches in a way, it sounds like. For some people, it may be quite often. Other people, they'll definitely have migraines, but it might be once every 3 months or brought on by stress or something like that. This kind of sounds the same.
You bring up a really good point, actually. A lot of times, what looks like Meniere's disease ends up being a migraine.
Interesting.
In fact, there is a condition called migraine-associated vertigo, which is very commonly confused with Meniere's disease. The two look very, very similar.
You often feel nauseous or
That's
maybe
correct.
a little dizzy, and
That's exactly right. They have very much overlapping symptoms. So it takes a lot of diligence to try to ferret out the differences between the two when evaluating a patient and determining what they have. In fact, a lot of times I'm not really sure if it's migraine or Meniere's disease, and it depends on how we treat them and how they respond to the treatment as to what we end up diagnosing them with.
All right, very good. Well, doctor, very interesting topic, and it's nice that there seems to be hope here and a clinical trial going on. And if you think you may be a candidate for this, so your first step is to call 562-270-4327, and then from there you can get the information necessary. and you'll be evaluated and see if this is something, first of all, a disease that you do have, and then if you're a good candidate for the trial. Thank you very much. Good to have you on.
Thank you very much. I always enjoy this.
Yeah, it's good to have you. All right, we'll be back.